When pregnant people smoke, their babies are exposed to the same chemicals and toxins from cigarette smoke as they are. These chemicals and toxins can harm the health of both the caregiver and the baby. Some of the most serious conditions include miscarriage, premature birth, stillbirth, low birth weight, and sudden infant death syndrome, or SIDS. Nicotine found in cigarettes and e-cigarettes can also harm the baby's developing brain and lungs. Quitting is one of the best things pregnant people can do for their health and their baby's health. Quitting earlier in pregnancy is best, but quitting any time during pregnancy can make a big difference. When pregnant people quit smoking, they have a healthier pregnancy, a healthier baby, and a healthier family. The prevalence of prenatal smoking is more than 3 times as high among pregnant people enrolled in Medicaid than pregnant people with private insurance. 14% of pregnant people with Medicaid smoked at any time during pregnancy, compared to 3.6% of pregnant people with private insurance. And pregnant people enrolled in Medicaid have a harder time quitting than those with private insurance. 18.4% of pregnant people with Medicaid successfully quit during pregnancy, compared to 28.4% of pregnant people with private insurance. Medicaid agencies and the Children's Health Insurance Program, or CHIP agencies, can play a key role in helping pregnant people get the treatment they need and supporting their cessation efforts before, during, and after pregnancy. Strategy 1. Medicaid agencies can make it easier for pregnant people to access cessation services by eliminating prior authorization requirements and coverage limitations. State agencies can also make sure that Medicaid and CHIP providers and beneficiaries are aware of the cessation services available to help them quit. Federal law requires states to provide tobacco cessation services without cost sharing for pregnant Medicaid beneficiaries. Strategy 2. Medicaid and CHIP agencies can increase the delivery of clinical cessation interventions by supporting health systems and providers to integrate treatment into routine care, such as using the 5 A's: ask, advise, assess, assist, and arrange, beginning with asking about tobacco use during the first and every prenatal visit. Also, Medicaid programs can link tobacco cessation quality measures to payment or other incentives. Strategy 3. Medicaid and CHIP agencies can support and partner with state tobacco cessation quit lines. Services offered by state quit lines include counseling, referrals to other services, mailed materials, and in many instances, web and text-based services. Most states offer pregnancy-specific services, focusing on the pregnant people's motivation to quit and providing postpartum follow-up to prevent relapse to smoking. The 2020 Surgeon General's report concludes that quit lines are effective at helping people quit. Medicaid and CHIP agencies can promote the use of state quit lines by including information in beneficiary communications, such as mailings and newsletters, and by including state quit line services in managed care requirements. State Medicaid programs can support state quit lines through Medicaid administrative fund matching or through managed care contracts. Quit lines can provide near real-time data back to Medicaid programs and providers about services delivered to beneficiaries. Medicaid and CHIP play a key role in promoting the health of birth parents and their babies. Medicaid programs cover from 23% to 62% of births in their state, which means that state Medicaid programs are there for many pregnant people and their babies right from the beginning. By addressing tobacco use early and often during pregnancy, Medicaid and CHIP programs can help pregnant people and their babies lead healthier lives.